We'll do this quick. The number today for new cases is 8,604. Yesterday's data was somewhat inflated because we had a couple labs that had not gotten theirs in or hadn't been able to clear into our system. And so yesterday's was artificially high. This 8,604, we think, is fairly close to where it is. We still have a backlog. We think about 6,000 cases which need to clear at some point. So today's data may be a little higher than that. But again, this is a high number. If you compare it, for example, to what our average cases has been for the last 21 days, you can see it certainly continues to trend upwards. Deaths are 98. Hospitalization 364. Again, this is higher certainly than the 7-day average, and number of ICU admissions is 29. Currently in our hospitals, we have 4,449 hospitalized COVID patients. That's 4,449. Of those, about a fourth, 1,046, are in intensive care. Statewide, we have about 20,000 patients in Ohio hospitals. Of those, there are 4,449, as I said, who are COVID. So it's between a fifth and a fourth of our patients in our hospitals are now COVID patients. Tomorrow, we will be putting out, because of Thanksgiving, we'll be putting out some of our data early. The map will come out tomorrow. Without a press conference, it will just come out one day earlier than it normally does. Also, our travel advisory normally comes out tomorrow. It will come out tomorrow. And just a note, we are very close ourselves in Ohio to being at a point where we would advise people to be very careful if they were traveling to us. We're at about 14% positivity now. 15% is where our line has been, where we put on the board, on the map, the different state, and say there's a travel advisory to that state. So I think that just sort of puts it into perspective where we are at this point.